purpose of this presentation is to discuss the high infant mortality rate in Louisiana. In order to eradicate the high infant mortality in the state, education of communities is detrimental. This presentation will discuss different methods to help this issue. The methods will be from a public health educator's perspective. I will first discuss the problem statement. The problem is simple. It is the high infant mortality rate in the state of Louisiana. The statistics read that within the 50 states, Louisiana is ranked 49th for its infant mortality rate. Both prenatal and postnatal deaths are included. In 2007, there were at least 9.9 deaths per 1,000 births. The infant mortality rate is attributed to factors such as prenatal care or lack thereof, the mother's health, access to health care, education, and socioeconomic status. Louisiana, particularly New Orleans, has many low socioeconomic areas. As a health educator, it is important to look at the issue in a public health context. So as we have learned, infant mortality in Louisiana is a major public issue. Louisiana remains one of the highest ranking states in the United States regarding infant mortality, which can eventually have a negative effect on communities. Interventions are very important. Therefore, education of parents and communities will play a major role in eradicating this issue. From a public health standpoint, the goal is to reduce the infant mortality rate in Louisiana through identification of health interventions, including prenatal care, social support services, education, home visitation, and community-based outreach. To understand the problem, we must determine the cause of it. There are many contributing factors within the social determinants of health regarding the infant mortality rate. First is low socioeconomic status. This plays a major factor because if individuals do not have access to resources, they possibly would not have access to proper health care. Secondly, would be the lack of or late prenatal care. Prenatal care is very detrimental to pregnancy outcomes, and without it, it puts one at risk. And lastly would be prenatal and postnatal unhealthy behaviors. Unhealthy behaviors such as smoking and drinking alcohol prenatal, or maybe smoking in the presence of infants postnatal, are behaviors that puts a child at risk. We can use the socio-ecological model to describe the issue of the high infant mortality rate in Louisiana. On each level, there are factors that help and hinder the efforts to decrease the rates of this issue. On an individual level, eating healthy during pregnancy helps the situation. Using tobacco during pregnancy hinders the situation. On an interpersonal level, family members help in encouraging healthy habits such as exercising during pregnancy helps the situation. Being around family members or friends who smoke in the presence of pregnant women hinder the situation. On an organizational level, healthcare organizations providing free screenings for pregnant women help the situation. And healthcare disparities amongst minority women hinder the situation. On a community level, Making foods healthy making healthy foods more accessible and affordable for pregnant women helps the situation, and decreasing the amount of Planned Parenthood agencies and communities hinders the situation. And lastly, on a policy level, development of policies to guarantee free prenatal to all expectant mothers helps the situation, and pregnant uninsured women who do not receive prenatal care hinders the situation. Now we will look at some evidence-based interventions which have proven and help in the effort to reduce infant mortality. One intervention is group visits for prenatal care. Group visits for prenatal care have shown at least a 5% decrease in preterm births in comparison to individual prenatal visits. Another evidence-based intervention would be public health campaigns to reduce smoking. Smoking during pregnancy has decreased significantly due to public health campaigns. Over a 20-year period, it has dropped from 42% to 10.7%. And the last evidence-based intervention would be home nurse visiting programs. Home nurse visiting programs has shown to have a significant higher level of live infant births than those who did not. In order to decrease the problem of infant mortality in Louisiana, interventions were proposed. One of these interventions include creating monthly health fairs to bring awareness to early prenatal care. These would be prenatal groups to help mothers support each other while obtaining needed information. Another proposed intervention is recruiting volunteer nurses to make home visits for mothers postnatal. And the last intervention would be developing programs within communities that bring awareness regarding the dangers of smoking before conceiving a child. Marketing campaigns will use posters to place in doctors' offices for education purposes. Women with complete surveys will be posted at doctors' offices. These interventions may sound ideal, however, there are potential barriers for each of them. The first intervention, creating monthly health fairs to bring awareness to early prenatal care. The barrier will be availability of mothers. A solution to that problem would be to try to schedule health fairs that are kid-friendly so that mothers are able to bring other children with them. Another barrier will possibly be unavailable accessible location for fairs. A solution to that problem would be to try to schedule location at least 6 months in advance to ensure availability of space. And the last barrier will probably be mothers unwilling to participate. A solution to that problem would be to advertise in doctors' offices, community centers, and local stores to help recruit women. The second intervention, recruiting volunteer nurses to make home visits. A barrier would be the lack of volunteers. A solution would be to offer incentives to volunteers who participate and provide their services. And the last intervention would be developing programs within communities that bring awareness regarding the dangers of smoking. And one of the barriers would be, or probably the only barrier, would be a lack of community participation. The solution to this would be to offer incentives to people in the community, for example, t-shirts, bags, raffles, just to increase the interest of the program. An excellent way to try to plan or strategize how to eradicate the issue of high infant mortality in Louisiana would be to create a logic model. This model displays the inputs, activities that would be helpful, the participation that would be needed, and the outcomes due to the activities and participation, and finally, the overall impact it would have on the issue. So we will first start with the inputs. Stakeholders in the community must collaborate to achieve the same goal. Governing agencies must provide resources such as proper licenses and permits. Federal and state agencies need to be involved in the development of programs to assist with provision of resources. Activities would be creating monthly health fairs to bring awareness to early prenatal care, recruiting volunteer nurses to make home visits for mothers postnatal, and lastly, developing programs within communities to bring awareness regarding the dangers of smoking before conceiving a child. The participation would be collaboration of stakeholders enables development of scheduled programs with participation of members of the community. Secondly, the use of permits and licenses from governing agencies enables the production of increased health awareness events at various sites in the communities, as well as the recruitment of qualified staff. The next would be federal and state agency funding programs for allowance of staffing and supplies needed. And lastly, in the participation section, would be the increase in contracts with federal and state agencies for continued assistance in community programs to help combat infant mortality. The column of the outcomes would be health programs are utilized by mothers within the community. This education would be carried over to better care for their children. Secondly, recruitment of highly qualified nurses would be initiated. This would be the nurses who complete the home visits for women in the community. The next one, federal and state grants would provide funding for child health programs. These grants will cover the staffing and any equipment or supplies needed to run the programs. And lastly, successful participation will lead to the development of multi-year contracts with federal and state agencies. This will help to continue the fight against the high infant mortality rate in Louisiana. And the impact will be, of course, the reduction in infant mortality rate in Louisiana. So in summary, in order to eradicate the high infant mortality rate in Louisiana, prevention must be priority. Education is a key factor to reduce the amount of infant deaths in communities. And lastly, interventions should focus on long-term lifestyle changes which can be carried over. And this will be the end of my presentation. I thank you for listening.